Part 4, we will look at government health insurance program and health insurance reimbursement. A government is involved in providing health insurance to select populations. We will look at these different programs and how they serve their select population. Medicaid is the program that would help provide health insurance to individuals above the age 65. Medicaid is provided through different components, Part A, B, C, D, and the supplemental insurance. Part A helps provide hospitalization costs. Part B is a supplemental health plan that would cover physician services. Part C, also called Medicare Advantage. It's a combination of Part A and B where they will help Medicare patients obtain other insurance programs such as HMOs and PPOs to try to get effective health care and to reduce cost. Part B is the prescription drug plan to help provide affordable prescription drugs. And then we have the Medicare Supplemental Plan or Medigap that would cover co-pays, deductible, co-insurance, and services that could be more expensive and not covered by other components of the Medicare plan. Medicaid is the insurance that is provided for low-income families. This was part of the Social Security Act and try to help provide medical care for those that are unable to obtain them. Medicaid is not a mandate program, but it's present in all states except for Arizona. Payors, which is a program of all-inclusive care for the elderly. This was authorized to the Balanced Budget Act of 1997. This is a comprehensive healthcare delivery system, also funded by Medicare and Medicaid, to try to focus more on health needs and services that are needed in the elderly population that might not be covered through the Medicare system. Say if individuals have certain needs with nursing homes or home level care, community care, these PACE program would help cover those expenses. And we also have the Children's Health Insurance Program, also called CHIP. And this is a program also to help cover uninsured children in the United States that don't qualify for the Medicaid program. So the population between the very poor and those that can afford will be covered through the CHIP program. Then we also have workers' compensation. This is employer financial liability type of program covering any certain injury, certain illnesses that could be result from the working conditions, and this would help pay the employees for medical treatment, for lost wages, maybe a survivor's death benefit, and even certain loss of skill sets or certain injuries associated to the workplace. Then we have TRICARE. TRICARE is the insurance that is covered or that is provided through the Department of Defense for those involved in military service. So this would provide health care for those that are in active duty or those that are retired, those that are associated with the armed forces. Last, we also have Indian Health Services. This is the health plan that would cover healthcare needs for the American Indian or Alaskan Native tribes. So now let's look at healthcare reimbursement methods. First, we'll look at the private system and how it happens in the private sector. Historically, service providers, healthcare providers would set the rate of their services, and they would retrospectively tell the insurance companies, okay, these are the services that we provided and these are the costs that are associated with this. This tended to be an increased healthcare burden as service providers could charge for all the services that they provide. So they were not held accountable for the type of services they were providing. So the trend has been towards going towards a prospective reimbursement method where the health insurance plans would come up with a service benefit plan and say for these services, these are going to be the reimbursements that are associated, or for these types of diseases, these are the reimbursements that would be involved. So this gives the healthcare providers a framework to know, okay, they need to stay within this framework, and then they will be able to be reimbursed for the services they've provided. Looking at the government reimbursement structure, again, this was done through mainly the Medicaid, the Medicare programs, and there were certain reforms that needed to be done even when it came to these types of reimbursement services. So there was this prospective payment system that was set up to help identify, okay, these are going to be the costs associated with each diagnosis. So a diagnosis related group, they have a certain expenditure, they have a certain procedures that were approved for a certain diagnosis and certain costs associated with that allowed reimbursement to happen in groups for a certain diagnosis. So this reimbursement method was able to control certain costs and say, okay, these are the costs that will be provided for that type of diagnosis. Then we also have the resource-based relative value scale reimbursement. Again, it's not easy to take one certain disease process and then come up with, okay, these are going to be all the costs. So it needed to be even subdivided further to see, okay, what's the physician's work involved, what are the other costs that are involved in this thing, and what is the severity, and try to come up with a certain coding system for the certain disease process and the severity, and what are certain expenditures associated with that. And again, this comes to the ambulatory patient group. This is a group that came up with a coding system giving a number or a value to certain diagnoses, certain treatment options, or certain services that are associated with that, and help come up with a standardized method when it came for reimbursement. So through the ambulatory payment categories, they were able to divide all the outpatient services, all the procedural services into different groups, and that was able to give like a cost associated for all those services, and that helped providing this prospective type of reimbursement method for healthcare providers. So then we also have the resource utilization groups. In addition to the services provided within a hospital system, there were other services that needed to happen within skilled nursing facilities that were using Medicare service or Medicare payment system. So there needed to be certain classifications, certain system that this could be organized as well. Then we have the home health resources group. This was implemented in 2000, where this is also another prospective payment group that is using Medicare, and they determined certain rates for episodes that might occur that might help bundle the cost even when it comes to services associated with home health care as well. So as you can see, there are these different ways where you can categorize the services that are provided in the certain type of environment and how they are associated with the payment system or the reimbursement system when it comes to the insurance company, insurance policy, or if it's a government insurance, how Medicare try to organize these types of reimbursements. So the final thing we'll look at here is going to be when you have a certain insurance company, insurance policy, there has to be certain structural a management system, because they have a mission in their company, whether it's going to be for-profit or non-for-profit. They have certain missions, certain goals that they need to accomplish to the program, and there will be certain individuals be who will need to take place, or who needs to provide certain leadership to be able to manage the finances they have and make sure that the vision of the insurance company, insurance program is met. So, final thoughts here. We discussed a lot about the different types of health insurance and how that was provided. We talked about healthcare expenditure and healthcare reimbursement. It's not only the expenses that are incurred through individuals taking the service, we also need to have mechanisms to try to pay the healthcare providers. Initially, there was this retrospective reimbursement method where the healthcare provider would say, okay, these were the costs that were associated with for caring for an individual, but now these have been changed more towards the prospective reimbursement system, which would hold the healthcare providers more accountable and give them more incentive to try to improve, to make their healthcare provision more cost